Hello, I'm Dr. Mark Graves. I'd like to talk to you today about the importance of exercise. It's important for everybody, but particularly for people who have diabetes, prediabetes, or obesity. This segment discusses the importance of exercise to people who want to lose weight. There are many benefits to exercise that are well documented in the medical literature. Exercise helps to reduce your weight, lowers your risk of cardiovascular disease, and also the risk of developing diabetes. Some of the benefits, such as improving your mental health, are not as well known. I surprise many of my patients when I tell them that vigorous physical exercise can boost your mood as much as some antidepressants. This video is about the wonderful advantage for dieting that you will receive for exercise. I always like to look at the data when I evaluate a medical issue. Many of the things that I will discuss come right out of the scientist's lab. Outcomes-based data is the best type of information for planning a medical project. A prime factor associated with weight loss is exercise. The more, the better. In my practice, I strongly suggest at least 3 hours of exercise per week for all dieters. The critical importance of exercise is almost obvious when you understand how your body handles calories. Let's follow what happens to food when you eat. When you eat food, you chew it up. It's further digested in the stomach. Then it goes to your small bowel. It's chemically digested here, and then it goes to your bloodstream. 4 hours after you've eaten a half a pound of food, there is a half a pound of food in your bloodstream. From this point, there's only 2 places for your blood to put the food. The food can either be put into glycogen, which is in your muscles and your liver, or it will be stored as fat. Glycogen is the short-term storage place where we would like to have as much as possible. Fat is the long-term storage place which we're trying to limit. There is one thing for certain. It's going to go to one place or the other. Our goal is to make as much glycogen as possible and to limit the fat as much as possible. It only takes about 10 minutes to make glycogen or to make fat. Your body is quick to use the glycogen and can use it within about 10 minutes. The fat, on the other hand, only takes 10 minutes to make, but it takes more than a day to break down. So with any circumstance, what is it we'd like to do? We want to make as much glycogen as possible and use the glycogen for our energy stores. Glycogen is a friendly molecule. Glycogen is a fantastic energy storage molecule. It's fast and efficient with storing and releasing glucose for energy. The molecule is built with a small protein core and a vast branched network of glucose units that spreads out from this core. One glycogen molecule can hold as many as 30,000 glucose units. You can consider each glycogen molecule to be like a high-density battery for your body's energy needs. Glycogen is a wonderful place for your body to store energy. Long-distance athletes, such as marathon runners and cyclists, do special training to maximize their glycogen storage capacity. Many professional trainers think that the winning athletes have the best glycogen storage capacity. They build training regimens that are designed to maximize glycogen storage. Our bodies are limited in how much storage capacity is available as glycogen. A non-exercising person has limited storage of only a few hundred calories of carbohydrates as glycogen. Anything more than this turns into fat. When we exercise, we not only get all the cardiovascular benefits, but we also change the characteristics of muscle and we're able to store more glycogen. We're able to store more calories as glycogen, and fewer of them will be stored as fat. Nothing but exercise can boost glycogen storage capacity. There's no pill or treatment that can substitute for exercise. So critically important, if you have diabetes, prediabetes, obesity, or just want to be a healthier person, exercise increases your glycogen storage capacity and helps your body to be well balanced and well controlled. My most difficult patients are people who do not exercise. These patient problems are difficult because their metabolism is not optimized for health. My prescription for all of my patients is exercise. It's a key part of good health and a healthy weight. Once you have achieved your goal of a 5 to 10% weight loss, we want to know what are the best predictors of maintaining weight loss. As you may have anticipated, the more you exercise, the more certain that the weight loss will be permanent. If you have lost a lot of weight, it will take high levels of exercise to keep the weight off. If you have lost more than 30 pounds, the data suggests it will require 60 to 90 minutes of daily exercise to keep this weight off. There are many health benefits of exercise noted on the CDC website. Every time I review these health benefits, it reminds me to restart my own exercise program. In addition to controlling your weight, reducing your risk of heart problems, improving diabetes, exercise can reduce your risk of some cancers. Although the benefits of exercise are truly fantastic, life is busy and it's easy to let the priority of exercise drop a level or two. Life just gets in the way sometimes. I find myself so busy that I have to stop exercising. Every time this happens, I restart. When I do so, it seems just as hard as ever and certainly as hard as the first time I ever started exercising. When this happens, I just get back to it again because I know how important exercise is to health. I keep in mind that exercise is as close to the magic elixir of medicine as it gets. It helps both the mind and the body. If you would like to further discuss weight loss strategies, I suggest an appointment with your primary care physician. You and your doctor can work together to design the best weight loss program for your individual needs.